with the umbilicus sitting in the center of the pillow. बाबूजी मुड़ जाइए, नाभि को तकिए के बीच में रख के उल्टा होके लेटेंगे आप. This is the exact position of the patient. उस साइड कर लीजिए सर. Now we scan the patient kidney where there is no collecting system and minimal vascularity, so that we don't have any hematuria or hematoma post biopsy. So the lower pole of the kidney is focused. Color is put to see that there is not too much vascularity there, and we are away from the collecting system. We like to go in the cross-sectional view rather than the longitudinal view, because there you can end up damaging the full cortex and we can enter the collecting system. So if we go in this cross-sectional view, we get the pulp of the parenchyma where there is minimal vascularity and very little collecting system. बाबूजी लंबी सांस लेके सांस रोकिए. The patient up there. छोड़ दीजिए सांस. इधर focus करना. We mark it grossly there. We use a sterile dressing tray. The first cover is opened. After that, we have to go sterile. Now we open the tray completely. Yes. We give a good wash with betadine. Clean it with spirit or sterilium, which the probe also with the spirit. Then we clean off the extra fluid. And then we prepare to give the local anesthesia. We give a generous amount of 5 to 8 cc's of local anesthesia. We start off giving it with the diabetic needle, which is very thin, superficially on the skin where we have marked. Choti sui babuji. You make a little bubble there so the skin is nicely anesthetized. That's where it hurts the most. And then you go deeper in. Nicely anesthetize the deeper tissues. Now we prepare for biopsying the patient. We'll use self-firing one. This is the way you prepare it 1 and 2 and get it ready for firing. This we take it off. This is the way it is ready when both the buttons are down, and then you fire. After you fire, you pull the first one down and you will get the tissue on this. So it's a 18 gauge tissue that you're going to get here. So again we get the lower pole of the kidney. बाबूजी लंबी सांस लेके सांस रोकिए. Very good. So we get the lower pole, pierce it, and we can see the needle going in, and you can see it indenting the tissue, and you fire. And then you open, and that's the tissue. You put the tissue first piece, we take it in saline so that the needle is not contaminated with formalin. And then we again prepare to fire the next one. Now just focus on the screen. Okay. If you can see, now this is the needle abutting the cortex. We like to fire at the capsule so that we get maximum gloms. Again we get a tissue. What we really actually like a tissue is with a little fat lip, so we know that we have not gone too deep in and we have got the complete cortex, so we will get a good glom count. So always nice to have a little lip of fat, which is the perinephric fat. Now we are putting it in formalin. And we are clean. This tissue has come out. Most importantly after that is compression of the puncture site. You give a compression for 5 to 7 minutes on the table. And then we check if there is any perinephric collection or hematoma that has happened. So deep, give a compression like this for 5 to 7 minutes. Dynaplast compression with it, with the overlapping way of putting it so that the compression is complete. So you cover only half the bandage there. And half like this so that the compression is complete. We keep compressing till the time the stretcher comes, then we roll. This is the scar for the kidney. So most of the kidneys are placed in the right iliac fossa, very rarely in the left, or when there's a second transplant then we put it here. So this is a right iliac fossa graft. All the things we need for the kidney transplant kidney biopsy are absolutely similar to what we need for the native kidney biopsy. We will now start. We take the first layer out of the sterile tray. The probe has been washed after the first patient and nicely sterilized. Now we are going to just put the cleaning procedure, everything is exactly the same as the native kidney. Cleaning the patient. Here again, it's very important in the transplant graft kidney, we take from the lower pole, because what happens in the upper pole, you will have a lot of bowel loop, and initially when we started about 20-25 years back doing these biopsies, we have had an injury to the bowel loop and we lost the patient to that. So now we are very careful that we only do the lower pole. Lower pole, no collecting system, wherever there is least vascularity. Please don't raise your head, leave your abdomen loose, don't put your hands under your head, yeah, leave it like that. So we tell them not to put their hands under their head because that increases the intra-abdominal pressure. So here we don't really do a check before for the site marking because we have a small window being a graft kidney. So we know we have to puncture it somewhere here, local. Very thin needle, it's not going to hurt you, sir. It will be like a little ant prick there. So that's the graft kidney we are seeing. We put it on the renal mode. So it's got very good perfusion, it looks very good. The parenchymal echogenicity is good, there is no calacial dilatation. And here again we try and take the lowermost pole, looks fine. So this is very superficial, right deep into the iliac fossa and going towards the pelvis. So again very small injection, so it's not going to hurt you, just relax. That's it. Again you give this little bubble here, you can focus on that so that doesn't hurt the patient because skin is most sensitive. Rub the bubble in. So just don't move, if you move you are going to damage your kidney, you have to just relax. Yeah, just take a deep breath and relax. If you move, increase your pressure, anything, it'll hurt your kidney. So then you go a little deeper with your local anesthesia. You can see that needle entering. And when you push it, you see everything spreading out. I'll increase the depth for you to see it clearly. So that's where we've entered. See that? That's my needle. Biopsy I didn't show you like that, which is bar coded, and normal saline is written or formalin is written like that. So now again we will do, first we will take a piece in the saline. We are again taking 2 pieces here. You can see this, we are in the lowermost pole. Can you see the needle tip? It is indenting the kidney. And we are going to fire. You saw that firing? I went a little close to the collateral system. This is a piece here. Looks a little pale. I'm going to take it in saline. Again, that's the thing, we fire, and now we take it in. This piece looks better, so we'll take it in saline again, and we'll take another piece for formalin. So if you can focus on this inside, I don't know if you can, you'll see a little fat lip there. Can you see it inside? Into the bottle. I don't know if you can appreciate the fat lip. Just zoom it in. So if that is there, then we know that we've got good cortex. We take another bite. You can see the needle tip, and we fire. Hold liya tha? Did you take the screen? Biopsy. Again, most important is the compression. Compress, compress, compress. We can't have the patient having a hematoma. Chances in graft kidney are more of hematuria, so we are going to watch carefully all our transplant patients. Just relax, sir. Just relax. You're very tight. Just relax yourself. Yeah. We are done. Biopsy आपकी हो गई है. Again, we need to give good compression. Just relax, sir. Relax. You can take.